Hi, everyone. Thank you so much to SAEM for the opportunity to present our work, Dumpster Diving in the Emergency Department, Quantities and Characteristics of ED Waste. And thank you to the PCPM program at Brown University for supporting this work. So to start with some background information, the US healthcare system generates about 4 billion pounds of waste per year. This makes the healthcare industry the second largest contributor to landfill waste. That's roughly equal to 6,600 tons of waste each day and about 42 pounds of waste generated per patient per day. So reducing healthcare waste helps reduce the environmental impact of healthcare and even lower hospitals' costs for waste hauling. The US healthcare system also contributes to 10% of all US greenhouse gas emissions, and healthcare waste is a direct contributor to these emissions. And finally, while there are many studies about reducing OR waste or hospital waste, there are actually no prior studies of emergency department waste audits, even though the ED accounts for a significant proportion of the US healthcare system. So for our study, we wanted to quantify and describe waste generated by the emergency department, and two, to identify any deviations from waste policy and see if there are areas for waste diversion. For our methods, we selected an ED in an urban tertiary care academic medical center with an average of about 309 patients a day for our 24-hour waste audit. We then had 3 shifts of environmental services collect all municipal solid waste, regulated medical waste, and recycling waste between a set 24-hour window. For reference, regulated medical waste included all items thrown into red bags, as well as all filled sharps containers. And for the recycling waste, we included all items thrown in recycling bins, as well as all paper with protected health information disposed of in a secure bin. Of note, for this study, we did not audit pharmaceutical wastes or universal wastes. Then all waste collected during our study period was stored in a designated collection space. We then sorted that waste into separate categories based on predominant material, and all these categories were subsequently weighed. The waste categories we selected are listed on the right, such as plastic, paper, food, glass, and unused items. Aggregate data on patient volume for this study period and for the fiscal year of 2019 were collected from the hospital administration. We also tracked deviations from healthcare and hospital waste policy using the hospital's infection control manual, state regulations, and HIPAA standards. For example, state regulations define that for waste that contains blood, if the blood products are in a free draining or liquid state, or if the materials are saturated or dripping with blood, then that waste goes into regulated medical waste. If it's not saturated or in a free draining liquid state, then that waste product with blood on it goes into solid waste. As a result, we sorted and tracked any waste that deviated from these regulations. And lastly, we calculated the direct pollutant emissions from ED waste disposal activities using the M+ waste care calculator. And what we found was that in a single day, the emergency department generated 1,480 pounds of waste, or roughly 4.4 pounds of waste per patient. The majority of this waste was solid waste, roughly 10% was medical waste, and less than 5% was recycling. When we broke down the waste by material, here we can see from the red and blue bars that over 60% of the waste was some form of soft or hard plastic. And when we looked through the medical waste bins, what we found was that nearly 85% of waste thrown into red bags was not medical waste. This is particularly concerning because medical waste costs about 5 to 10 times more than solid waste to dispose of, and the disposal of medical waste generates significantly more pollutants than solid waste. And in terms of waste policy, we found post-ox probes thrown away that should have been set aside for reprocessing. Other fun findings include we found 30 plus unopened cranberry juices in food waste, and someone even threw a brand new trash can in the trash can. And here we have pictures of unused items. We found more than 200 unused items in both solid waste and medical waste. And we found that if waste disposal were optimized, nearly 74 tons of waste could be diverted from the landfill each year. In terms of greenhouse gas emissions, we found that 1 day of waste disposal results in over 3,000 kilograms of carbon dioxide equivalents. That's the equivalent of driving a car 7,700 miles. And this only represents the pollution from the disposal of waste. This does not include the upstream environmental costs of their production, distribution, and use. And keep in mind that over 70% of these emissions actually came from the disposal of regulated medical waste. So to conclude, the ED generates significant amounts of waste, and there are many ways that ED waste disposal practices can be improved to reduce waste, increase adherence to waste policy, and reduce environmental impact. We encourage other EDs to examine their waste disposal practices and find ways to reduce waste and reduce their environmental impact. Thank you so much for listening.